And it changes, which is good because issues change.
All the time.
And
That's
we need
right.
to be flexible and able to address those issues as they're coming about, not after. Like Jeanette said, to prevent that first use, that's really a big thing. And how do you keep on top of the newest and the latest?
That's right.
Right.
That's right. And those things do change. As you said, you know, I'm thinking back over the last even just 15 years and remembering when things, you know, crack cocaine, and that was a very definitive point in time, wasn't it, when that came about, and ecstasy came about at a certain point in time. So it's very important that there is sometimes that review of what's an issue.
And I think that's the wisdom of the Governor's Council, is to give that authority from them to the community, so that the community has empowerment. They don't feel like they're constantly behind, you know, and trying to catch up, that they can make a difference, and they do.
Now, are the members of the municipal alliances, and again, I realize these are in each town, so while you're representing Somerville, you can determine each year, is it your steering committee that decides which areas need to be focused on? So those issues may change?
Those issues may change. You have a survey that is given through Jakarta, the government, the state Governor's Council. And out of that, you start to identify particular issues that your community is experiencing. And then you look at what is the risk factor that this child is undergoing, and if they are in a risk area, then what is it that you can do which would abate some of that? So what do you do to protect them? That's how the programs then develop. We sit down and try to figure out, with input from teachers, from principals, from law enforcement, to say, well, you know what, we need summertime activities, or we need something going on at graduation, or we need something that addresses Red Ribbon Week, you know, to talk about
why don't you tell us a little bit about some of these activities? So you've mentioned Red Ribbon Week. What is that about? And
Red Ribbon got started with a DEA agent who was killed, and in memory of him, people started to band together across the country to wear a red ribbon. And the red ribbon signifying solidarity for drinking and driving, to, you know, make a statement. We can't have enough voices out there. They hear it from their teachers, but they need to hear it from their peers. So red ribbon is... Yeah, I know. Well, that's true.
Well, that's not true. I take that back, actually, because there are ways that we can. So I'll retract that.
Some do, but here's the secret there, I think, is that you just keep talking. Lay something out in the bathroom where they can see it, you know, and they'll think, what does Mama know that I don't know, you know? But the Red Ribbon Week goes from, in October, starts the idea of prevention, and goes right through to the end of the year with different activities. And some of those activities are geared to, like in the elementary school, character ed, making a good choice. You know, deciding what's right or what's not right for me, and saying
so
no.
While you're based at the at Immaculata High School, your programming, though,
our program
down to the grade
goes from
schools.
the elementary right through to the high schools. We have 2 high schools and 3 elementary schools.
And is that typically the case of all the municipal alliances?
Yes, absolutely. That's the reason getting people on your board, being appointed by the mayor, is really critical, because they bring to you from the different areas of your community, your seniors, your young, all of what the issues are, and then you look at how to do that.
Now, I was reading that you have another activity, an event coming up called Project Graduation, and if I could just share something, a stat that is kind of astounding to me, but really does speak to sometimes the way kids think, and forgive that statement, but we know that sometimes kids think the impossible, and this is quite a statement. Basically what this says is that students may be more likely to drink and drive on prom and graduation nights, according to a survey of 11th and 12th grade students across the country. And here's the stat. Nearly all of the students surveyed, about 90%, said that their peers are more likely to drink and drive on prom night. 80% said the same for graduation night. Despite this belief, students do not seem to think that driving, they do not seem to think that driving on these nights is dangerous. Somehow there's a dot not being connected, right? So tell us what happens on project graduation or prom night
yeah,
events that you have?
The issue of getting that voice out in out of many mouths really is important, because kids, based on that, Caesar facts, is that, you know, they put blinders on, they don't see that.
Right.
Project Graduation is a drug-free, safe place where all kinds of activities are taking place. This year, Somerville High School will celebrate Project Graduation, a post-graduation party. It's an all-nighter, well-supervised. It'll be at the Welborn Center.
At the Warblin Center.
Warblin Center, at Rutgers.
Okay.
There'll be all kinds of activities. Nobody's going to be sitting there twiddling their thumbs and you know, tweeting to people across the country, because they're going to be so busy. Now, with that comes the expense of that. They're going to be giving prizes away, like CDs and really things that kids, you know, are plugged into, iPods, things like that. Right. And those things have to be sponsored by corporate businesses. So Project Graduation, we have assumed some of the responsibility to help them with the rent, so that they can have a really nice facility for that. And it tells you that the community is willing to stand up and say, look, you can party without putting yourself at risk.
Right. And you know, it's so...
And that's important.
That's critical. And it's interesting to hear you say, you know, that there's corporate support as well. Because it's one thing to preach something, but it's another thing to step up to the plate and say, we have to resolve what we see that as me being the problem. So let's come up with a solution, and to do that collectively. And I mean, to myself and public health in general, it's these kinds of partnerships that make it happen. Because you can't do it alone as a municipal alliance. You can't do it alone as a coordinator of your programming. Right. Dare I say, it takes
the partnership for a drug-free New Jersey, which Jeanette represents, is just a wonderful example of the fact that you cannot do it alone. We all need each other's expertise, but we also need each other's support, networking, you know, that says, and hey, you know, I can get on the phone, call Jeanette and say, hey, what's going on? You know, I've got this, and this, and I need some direction, you know.
Absolutely. I wanted to mention another piece of the work that you do, and you alluded to this earlier, that it's really not just students and youth that the Municipal Alliances utilize as a way of getting out information. A program called Operation Medicine Cabinet was held in the state back in
November. The partnership.
And the partnership supported that. I'd like to share yet another stat, if I may, just to kind of couch this issue. Again, another survey of teens, and I assume that's 13 to 18 range. 40%, and the number was 9.4 million, the teens who were surveyed say they think prescription medications are much safer than illegal drugs, while 29% believe that prescription pain relievers are non-addictive. Again, this is this
education is the key. Education is the key, because their perception is maybe that the doctor gave that prescription, so it may not be harmful, but it can be harmful. So that's why we want to educate our parents, our youth, our caregivers, our community people, so we can keep spreading the message that, you know, educating about substances, even prescription drugs, they could cause harm, and we want them to be safe.
Well, let's talk about that particular event, the Operation Medicine Cabinet. New Jersey was in the forefront?
The Partnership for Drug-Free New Jersey sponsored that. And from them sponsoring that last year in November, they were also going to do an annual this year. But